Hi, Dr. Wadley with Walter Chiropractic and Wellness. Today we're going to teach you how to use the foam roller.
All right, when you're using the foam roller, just remember, discomfort's okay, pain is not. You'll notice those knots that will be a little bit tender, but if it's painful, be sure and mention to that on your next visit. All right, I like to start with a mid-thoracic spine. You're actually only covering about 12 inches. Don't try to cover it all at once. First of all, just sit down and then lean back up against the foam roller. Cross your arms across your chest and gently roll up and down. All you need to do on this is 10 to 20 passes on a daily basis. To move up to your upper thoracic, put your hands behind your head, wing your elbows out, and move on up to that general area. Okay, again, roll up and down. Those elbows being out like that will help keep you from rolling off to the end of the roller. All right, again, 10, 20 passes. Lower back, go ahead and sit on the roller. Get up into that crab walk position, walk on down to your lumbar spine, and again, gently roll 10 to 20 passes. I like this position because you can actually determine how much weight you put on that spine. The last technique is actually to stretch out those anterior muscles. Sit on the foam roller, make a goalpost out of your arms, and gently let those elbows drop towards the floor. This is stretch out those muscles that you day in, day out contract all day long. You'll love this. This isn't a number of reps, it's actually 2 or 3 minutes should do it justice. But just lay on it until you feel those muscles stretch out. Well, that's the foam roller. Keep it simple. If you have any problems or questions, just ask us the next time you're in the office. Take care.